Well, first of all, welcome. My name is Brooke Rollins. I have the great honor of being in President Trump's cabinet alongside my friend, Secretary Bobby Kennedy. We have some incredible guests today, the governors of Indiana and Arkansas, who you're going to be hearing from, and of course, our great congressman from Indiana. But let me just start with this. Today is a great day for American taxpayers and for the people of Indiana, Arkansas, Idaho, and Utah. It's a sad fact that over 75% of American youth between the ages of 17 and 24 are ineligible for military service because of obesity, poor physical fitness, or mental health challenges. Think about that, 75%. Over 350,000 American children have been diagnosed with diabetes, and autism spectrum disorder impacts 1 in 31 children by the age of 8. As the MAHA moms in the room and those listening know, and I consider myself one of those with my 4 teenagers you can see on the wall, as the MAHA moms in the room and otherwise know, behind these statistics are moms and dads, sons and daughters, neighbors and coworkers. I have long said, along with our president and others, that agriculture is at the core of the solution. American farmers produce the best, the safest, and the most affordable bounty in the history of the world. Since my confirmation, this department has encouraged states to think differently and creatively about how to solve the many health issues facing Americans. In fact, within the first hour of being sworn in by Justice Clarence Thomas, came back to this office, sat at that desk, and signed the very first letter I sent out, which was to all 50 governors around this great country, asking them to be our partners in the innovative solutions that are necessary to work toward this common goal. One way, as we know and why we're here today, is disallowing taxpayer-funded benefits to purchase unhealthy items like soda, candy, and other junk food. SNAP is a supplemental nutrition program meant to provide food benefits to low-income families to supplement their grocery budget so they can afford the nutritious food essential to health and well-being. This is what is stated word for word in the law, and President Trump's USDA will deliver. So today, I'm proud to sign 3 more waivers: Idaho, Utah, and Arkansas. This brings the total count to 6, and we have a few more working through technical assistance, including Colorado, Kansas, West Virginia, Texas, Ohio, Florida, and Louisiana. I continue to encourage states to be our laboratories of innovation, just as our founding fathers envisioned 249 years ago, thinking through how they can promote healthy families and healthy communities together and in partnership with us here in Washington. I appreciate the historic partnership between USDA and HHS, collaboration with our wonderful partners at the Domestic Policy Council at the White House, and the visionary leadership of Governor Braun and Governor Sanders. We together are doing something about it. We at USDA have also worked with America's dairy producers to voluntarily remove artificial colors from products sold to K-12 schools for the upcoming school year. And even in the private sector, Tyson Foods has committed to voluntarily removing petroleum food dyes from their products. To date, USDA has purchased over $300 million of fresh seafood, fruits, and vegetables from domestic producers through the Agricultural Marketing Services Section 32 program to distribute to food banks and nutrition assistance programs around this great country. Secretary Kennedy and I continue to work diligently in crafting the new dietary guidelines for Americans, which are set to be released very soon, way ahead of the current deadline. The nutrition advice through those dietary guidelines must be sound, simple, and clear. These guidelines will prioritize whole, healthy, and nutritious foods such as dairy, fruits, vegetables, and meats, and recommend limitations on unhealthy foods. More to come. President Trump and all my friends have know that our current health outcomes, especially for our children, are unsustainable, and that American agriculture, again, is at the heart of the solution. I am so proud to stand here today at USDA alongside Secretary Kennedy, Governor Sanders, Governor Braun, and so many other governors, Governor Cox from Utah, Governor Little from Idaho, who can't be here today, but are with us and will soon get these waivers. And also Congressman Baird, as we work to make America healthy again, especially knowing that the best is yet to come. Now I'd like to turn it over to, again, my partner in this effort, Secretary Bobby Kennedy of HHS. Thank you all.
Thank you, Secretary Rollins. When I was a little boy living in this city, my uncle was president, I was 10 years old. The chronic disease rate in our country was around 3%. We spent 0 on chronic disease. Today, chronic disease in our children is up to 60%. We spend about $1.7 trillion a year treating it. The cost is going up 2% faster than our economy is growing, so it's unsustainable. Secretary Rollins pointed out about 75% of our kids can't qualify for military service, but the injuries are much deeper. We have a whole generation that's plagued by autoimmune diseases, by neurological diseases, by allergic diseases, food allergies, peanut allergies, etc. The fertility in our children has dropped dramatically. Girls are reaching puberty 6 years earlier. American teenage boys have sperm counts that are about 50% of 65-year-old men. Their testosterone is about half of what a 65-year-old man has. So this is a crisis for our country. The cancer rates are also exploding. We know that the part of the problem is that we're not giving our children good food. The exposures are coming from chemical additives in our food. And we need to create, and then just bad food, sugar drinks like sodas. And for 20 years, Democrats and Republicans have been talking about this on Capitol Hill and saying, why are we paying for this? If somebody wants to drink a soda pop, we have no problem with that. We believe that we have freedom of choice in this country. But taxpayer dollars should not be funding these injuries to our children. And we pay for it twice. We pay for it through the SNAP program, and we pay for it later on with diabetes and obesity. And we pay for that at CMS, which is my agency, through Medicaid and Medicare. And President Trump has asked us to make America healthy again. The first time in our history, we have a Secretary of Agriculture of USDA, Brooke Rollins, who has the courage and gumption to actually do what people have been talking about for years and years and years on both sides of the aisle. And one of the reasons this hasn't happened before is because the lobbying headwinds, the power of these industries, of the sugar industries, and particularly sugar soda. And Secretary Rollins told me, yeah, they came to my office, and I said, what did you tell them? And she said, we're paying for nutrition, and there's no nutrition in your product. And that one of the leaders of the lobbying group said, well, this program is not about nutrition. And she said, it's called the Supplemental Nutrition Assistance Program. It's about nutrition, and there's no nutrition in these products. We shouldn't be paying for them with taxpayer money. President Trump is not only promising to make America healthy again and acting on that promise, but also he takes very seriously his responsibility to be a steward over American finances. And this is money wasted. It's money that is poisoning people. It's poisoning a generation, the poorest kids in our country. And then we pay a high price for that in the explosion of chronic disease. I'm very grateful for your leadership and your partner. We have a very, very close, not only partnership, but also a friendship. We're working on the dietary guidelines. We're shrinking the dietary guidelines from what President Biden gave us, 453 pages, that reflect all of the industry interference and influence that drove Fruit Loops to the top of the food pyramid. And we're going to give people nutritionists, doctors, physicians, school lunch programs of the military, dietary guidelines that are 4 or 5 pages written in plain English that people can understand. So we can start giving our kids good food again, and food is medicine, and we're going to start making them healthier by giving them better food and not paying for the food that is making them sicker. It makes no sense. And I want to thank the governors. Brooke and I have been all over the country, to West Virginia, to Arizona, to Utah, and working with these governors. We're standing up now and petitioning to Secretary Rollins for SNAP waivers, and people have answered the call, and we're very, very happy with that. And we have 2 of the leaders, I think, just Governor Sanders, Huckabee Sanders, and Governor Brune, who are here today. And I wanted to thank Congressman Bear for his leadership on this issue. 2 of them have made it now to the finish line. I want to thank you, Governor Sanders, for not only applying for the waiver, then doing the paperwork and jumping through all the hoops that we need to get this across the finish line. And I'm very excited about actually watching Secretary Rollins sign a waiver with Arkansas today.
Thank you, sir. Well, I'll be very brief, but this is an exciting day, not just for the state of Arkansas, but frankly for the entire country. For us to be able to take action that has been talked about for so long, to Secretary Kennedy's point, both sides of the aisle have said this was a priority, yet it took Donald Trump getting elected, putting the right team in place to make it happen. If you had said even a year ago that these waivers would be getting signed so quickly, I don't think most people would believe you. But the changes that this president is empowering his team to make for the betterment of all Americans is something that is unprecedented. I love that I get to be part of this with my good friend, Secretary Brooke Rollins. We got to know each other working at the White House, and I know that this is something very personal to her. This isn't just because it falls under her purview as the secretary, but because she's a mom. And it's something that was what we initially bonded over, is surviving working in the White House as working moms. And so the same way that I know that she is thinking about her own kids, that's one of the things that motivates me to see this get done and get across the finish line, is the fact that I am a mom of 3 kids, and I want something better for our kids. And I think that's what this president and the team that he has built are delivering on for the American people. We now have a food stamp program that's $119 billion a year, and $27 billion of that program are being spent on soft drinks, candy, and unhealthy desserts. It is insane to think that in the same building that we administer the food stamp program in the state of Arkansas, where we give out these food stamps and provide what is supposed to be nutritional assistance, is the same building where we're paying for all of the chronic disease that is taking place in the state of Arkansas. Over 1/3 of our population is either diabetic or pre-diabetic. And the fact that all of that takes place within a few feet of each other shows you just how backwards and how broken the system is. And now we have an administration that is actually doing something about it. We have in Secretary Kennedy and Secretary Rollins people who aren't just talking about making changes, but are implementing change that has been needed desperately for decades here in this country. They're taking on special interests every single day and winning in a way that no other administration would have been able or willing to do. And while Brooke cheers for the wrong football team every fall, I think that she is cheering for the right things to happen. I had to get that in there. She's cheering for the right things to happen in this country. And there is nobody that I have greater confidence in helping us make sure that our kids in our country are healthier. And that has to be something that we start focusing on, not only because we want our quality of life to be better, but we are bankrupting our country because of what we are doing and the way that we're operating. So I applaud the leadership of Secretary Kennedy and Secretary Rollins on bringing so much awareness to this, but also not just talking about it, actually taking action and getting something done. And I'm proud proud to stand alongside other conservative governors and members of Congress who are stepping up and getting things done. Governor Braun has been a great leader in this effort, and proud to stand alongside him and see both of us get this through to the finish line. And so with that, I'll turn it over to my good friend, Governor Braun.
Thank you, Governor. So some of you know I spent the last 6 years in the U.S. Senate on the Senate Health Committee. And I can tell you in those 6 years, we've seen more actually impacting health in these first 6 months by a large measure. I drift back to 17 years ago when running a small business that was really starting to grow, and how every year you look at what the consequences are of not stressing prevention and wellness. Wellness meaning food quality. Well, your health insurance costs were lucky to only go up 5 to 10% each year. I got sick and tired of that back then, got involved in that renewal meeting, and probably the proudest thing I've done in business, our government, would be having a health care system. When I got all the truth out of the insurance companies, why don't you start, if you want to change things, start in promoting wellness and prevention, because they knew I was going to do something different with that insurance plan. I did it. It was running 17 years now, based upon that and getting consumers, employees, engaged in their own well-being. We've not had a premium increase at that business. I've not heard of that anywhere. That's how you fix a broken healthcare system that's based on expensive remediation, not trying to make it something you don't need to spend money on in the first place. This administration is getting at the core of it. What ails us in terms of our health? Well, we spend way too much money on trying to fix bad behavior, and when I was able to give an executive order that says we're not spending government money in Indiana on sugary drinks and candy, what can make more common sense? And thank you two for bringing it to the forefront, because you've just heard of 3, 4, 5, 6 governors that are doing it, another 3 or 4 ready to. This should cascade across the country, and with this kind of energy, this kind of enthusiasm, that's how we fix the underlying issues. Thank you so much for doing it. It's now my pleasure to introduce fellow Hoosier, Congressman Jim Baird.
Thank you, Governor, and good afternoon. So I thank Secretary Rollins and Secretary Kennedy for allowing me to be with you today. I thank you for all the hard work to make America healthy again and deliver on President Trump's successful agenda. Thank you to Indiana's great Governor Mike Braun and Arkansas's Governor Sarah Huckabee Sanders for being here and leading on this issue. I thank Secretary Kennedy for joining us in Indiana back in April for the signing of the governor's executive order, the Secretary Rollins for quickly signing our state's waiver. Indiana is truly leading the way to make Hoosiers and Americans healthy again. Indiana was one of the first states to make these changes to SNAP, and Indiana was the first state to waive SNAP coverage for both soft drinks and candy. Notably, Indiana's waiver was signed the same day that Make America Healthy Again Commission report was released, further underscoring our commitment to improving nutrition. Now Indiana has a historic opportunity to improve Hoosiers' health and support our robust agricultural industry. Our farmers produce the most abundant, safe, and affordable food supply in the world. And let's work with our farmers to get their healthy, fresh produce to our kids and our families so they can receive the healthiest foods available. Americans' tax dollars should not be SNAP subsidize unhealthy foods that continue to have and lead to chronic disease epidemics. Every single American should want our federal programs to be different and be efficient, and we want our tax dollars to provide real nutritious meals and incentive Americans to live healthier, longer lives. Thanks to Secretary Rollins, Secretary Kennedy, Governor Braun, and Governor Huckabee Sanders, and so many others, that we are making support our farmers and make America healthy again. Thank you.
Thank you, everyone. We're now going to move to the desk. I'm going to sign the waivers. We'll take a couple pictures, and then we'll open it up for questions. Arkansas first, as it should be, other than the Hogs.
Good friendly rivalry.
Yes. Next is Idaho, Governor Brad Little. Yes. Idaho. And finally, at least for today, with more of these coming in the next few weeks, Governor Spencer Cox of Utah. There's Utah. All right, and with that, everyone, we will open it up for questions.
Hi, Secretary, thank you so much for taking questions.
At the podium, please. Podium, please. Podium, please.
Do y'all need us at the podium?
Yes.
Okay. we'll move back
For
to
your
the podium.
first name, last name, and address, please.
Yeah.
Helena Bottomiller Evich with Fix. You all talked about the dietary guidelines and needing to reissue those and some big changes, simplification. I know Secretary Kennedy has talked about, I believe, used the term poison to describe the current state of the school meals program. Can you talk about what your plans are for that program? Are you going to be updating the rules that underpin them, the nutrition standards, or like what comes next after the dietary guidelines?
Well, within the, there's two areas of partnership between my agency, HHS, and USDA, and those are key areas to making our food supply better. One of those is the SNAP program to get all of the unhealthy food off of SNAP. Different states are looking at different formulations. Some of the states are trying to get rid of candies and sodas. Most of the states have targeted sodas exclusively. We're hoping eventually to expand those categories to include other, perhaps ultra-processed foods or whatever. That's going to take a while. The other issue that we're dealing with that I think is a game changer is the dietary guidelines. We're going to make the dietary guidelines so people are getting whole food, they're getting real food. We're going to take ultra-processed foods off the menus. We're going to address the added sugars in the foods. And those dietary guidelines are important because they govern ultimately and they drive the school lunch programs. They drive the meals in the military. They drive other government purchases, and they will have an immediate impact in getting healthier food, more wholesome food to the American people.
Yeah. I'm just going to say something very quickly, and then I want to give the mic to Governor Sanders. And the reason is this, that while Secretary Kennedy and I are very diligently working on those dietary guidelines with our incredible staffs from both sides, those will be out sooner rather than later. As Secretary Kennedy mentioned, it will drive a change in the way we do school lunches, et cetera, around the nation. But ultimately, again, as the founders intended, the states are the laboratories of innovation. They are the guardians at the gate. They take these guidelines and then hopefully innovate in a way that moves their states, their population toward the goal of making America healthy again. So Governor Sanders and her team in Arkansas has been very innovative on this, and I'm going to ask her to talk just a minute about it to give you a sense of how this kind of the partnership will work with the states. This is not a Democrat or Republican thing. It's not a blue state or red state thing. This is a making America healthy again, working across party lines.
Thank you. One of the things that we have recognized and something that we've done in our state, and I think anybody who has seen a hungry kid knows that hungry kids don't learn. And so by really looking at how we do a better job from a state perspective of making sure kids aren't starting the day hungry, one of the first things we did was open up free breakfast to every single student in the state of Arkansas, in addition to the lunch program that has always existed in partnership with USDA. So now we've expanded that to include breakfast, but we don't want kids just eating a meal to check a box. We want them to be fueled with healthy, nutritious foods that are going to help them pay attention and be less distracted, but also meet that hunger need. And so while at the same time supporting one of the most important industries, not just to our state, but frankly to our entire country, and that's our ag industry. And so by incentivizing our schools to purchase more homegrown products, it's a way to not only help our students have healthier, more nutritious foods, but it also helps support one of the most important industries in our state. Big believer that if a country has to rely on anybody else for food, that's a big problem. And it takes away one of the things that makes America's ability to be free. If we can't feed ourselves, fight for ourselves, and fuel ourselves, then we become independent or dependent on other countries. That is a big problem. So looking for innovative ways we can support our agriculture community while addressing some of the food insecurity problems in our state has been a big priority for us, and some of the things that we've been working closely with USDA and also with HHS. And that's what I think that these guidelines will really help inform decisions for states as they're looking at a lot of those food programs.
Yes, ma'am.
Christina Peterson with the Wall Street Journal. Do you anticipate any changes around limits to saturated fats in the dietary guidelines or any changing attitudes toward them?
Saturated fats in the guidelines. We're looking at everything right now. I don't want to make news today, but you'll be hearing a lot more on this in the coming weeks with the goal of really in the next month or two having the full set out. Again, many months ahead of schedule, but this is how important we think this is. But everything's on the table, everything's being discussed, and we look forward to putting out a guideline that will hopefully drive this next round of health for our country. Yes, you next, and then yeah.
Thank you. All right, Lori Taylor with the Produce Moms, proud to live in the state of Indiana. And I'd like to, I know that we all agree it's not nutrition until it's eaten. And so as this administration works in partnership with the states, what are we doing to incentivize and prioritize fruits and vegetables in this quest? I see it as pathways like with programs like GusNIP, but I also see a lot of common sense opportunities like getting more flavorful fruits and vegetables into school meals. Our American farmers have made tremendous investments in all of the seed innovations and the variety innovations to really bring flavor forward in fruits and vegetables, and that's something I'm hoping that all of the leaders here today can take into consideration.
You make a really good point that if we're recommending foods that the kids don't want to eat and that ends up in the trash can, we haven't done any good to anybody. And, as Secretary Rollins pointed out and Governor Sanders pointed out, ultimately those decisions are made by the state. Our function is to use the best science to tell them the kind of generalized guidelines of what they should be looking for. If you have a lot of ingredients in the food that you can't pronounce, it's probably not too good for you. But the food for school lunch programs, for example, is sourced locally, and those decisions are going to be in the hands of the governors of the school districts, et cetera. We're going to do our best to support them by giving them good science-based guidelines on what the kids should be eating, what kind of portions they should be eating, what levels of meat and vegetables, grains and fruits, and as you point out, saturated fats.
Yeah. And whole milk back in schools. Yes, go ahead.
So you're healthy Indiana mom?
Yeah, of course.
Love it. So I can tell you, I've been on this whole idea of prevention and wellness and holistic health, and I'm going to invite stakeholders like yourself and others to come into the governor's residence or the Capitol. I want to hear about the ideas. I'm going to be encouraging businesses that have to pay most of the bill on the private side of health insurance, mostly, again, to remediate chronic illness. So in my state, I'm going to welcome everyone to come in and let's get the ideas together, because it's not going to be a flash in the pan. I want to hear it and get it from the grassroots up. And I'm sure you're going to see a different variation of that from the other 49 governors as well.
That's right. Yes, sir.
Yes, Secretary Rollins, Jerry Hagstrom from the Hagstrom Report. Will the Arkansas waiver allow the food stamp beneficiaries to buy hot rotisserie chickens, as I know Governor Sanders proposed?
We are working through all the technicalities of that. That is a significant pivot from before, but obviously getting nutritious foods and the hot rotisserie chickens and others are a major part of that, but we're moving in that direction. Thank you. Yes?
What other, and this is for Secretary Kennedy as well, Secretary Kennedy, what other food categories specifically, you said ultra-processed foods, but what other foods do you want to expand the SNAP waiver to? And maybe for the governors, would you be open to expanding that? And then big news on the ACIP today at CDC. Just wondering if you could expand on what your ultimate goal is there. If there's changes to the vaccine.
And tell us who you're with again.
With ABC News.
That's right. Thank you. ABC News.
Yeah, I can't answer what other foods are going to be on. We're looking at the science now, and we're looking, and this is going to be the product of negotiations, deliberations by a lot of people in our agencies. In terms of the changes to ACIP, this has been a long time coming. More than 2 decades ago, Congress investigated ACIP. The Government Oversight Committee found that, for example, that year, which was 2003, they gave one example that 4 out of the 5 people who added the rotavirus vaccine to the schedule had direct financial interest in that vaccine. One of those individuals voted the rotavirus onto the vaccine and sold his rotavirus vaccine that he had in development for $186 million. He said he won the lottery. That year, Congress said that 97% of the people on ACIP had undisclosed conflicts. So people have known about this for years. You know, probably the worst example of malevolent malpractice has been adding all of these new products to the schedule without doing pre-licensing safety studies. So in 1986, there were 11 vaccines on the schedule. Today, a compliant child must take between 69 and 92 vaccines to stay in school in some states. And not one of them has been safety tested in a pre-licensing placebo-controlled trial. And that is just malpractice. So the people who were in charge of that are now gone. And we're going to bring people onto the ACIP panel, not anti-vaxxers. We're bringing people on who are credentialed scientists, who are highly credentialed physicians, who are going to do evidence-based medicine, who are going to be objective, and who are going to follow the science and make critical public health determinations for our children based upon the best science.
Yes, go ahead.
Can you explain how you're going to measure if these new restrictions on the SNAP waivers are working? And I just did want to follow up on ACIP. Will you get those new appointees in place before the June 25th meeting?
Yes.
We are working with all the states on the metrics. It's an amazing question because often these changes are made at the government level without any real metrics in place. So we're working state by state, how we measure what this looks like. But listen, this is a long-term effort that is bipartisan, or even nonpartisan, I should say, that ultimately at the end of the day, the real metric is in the health of our communities. But we will be looking step by step. And I'm sorry, tell me who you were with. AP, great. Thank you. Great question. We'll be talking more about metrics moving forward, but we're already in discussions on what that looks like. Thank you. Yes, in the back.
Emily Croft with the Daily Caller. Any comment on the Chinese nationals accused of agritourism, and can the American people have confidence that USDA and HHS won't fund research on pathogens like H5N1 that pose a risk to American agriculture with PLA-connected individuals in labs?
Yeah, we've put an end to all dangerous gain-of-function studies. It's over. It should have never been done, and it won't be done again.
Yeah. All right, thank you, guys. Can I add one quick thing, because it's really important? And Governor Sanders mentioned this, but it goes directly to the heart of your question. If we don't have food security in this country, we will not have national security. And so Kash Patel and the FBI and Pam Bondi's DOJ finding and arresting those suspects was very important, but it's just the first step. We have a wholesale look at everything at USDA, every piece of the agriculture community, to ensure that we can feed ourselves, fuel ourselves, et cetera. There is no America unless our food security, our food products, we can feed ourselves. That is through the robust support of our farmers and our ranchers, and ensuring that we continue to not only feed ourselves, but feed the world. And that is a very complicated, complex, layered approach. You'll be hearing more from me, just a little teaser, in the next week or two on a massive new initiative that will look at that specifically. Food security is national security. So that's just one step, but you'll be hearing a lot more from us on that moving forward. Thank you all for being here at the People's Department. Great to have you all, and we'll be updating you regularly. Thank y'all so much. Okay, so we're going to have that one.